Greetings, everyone. I'm Emma Nalianya. I'm the moderator for today, and I also serve as the president of Federation of African Medical Students Associations. So I would like to welcome you all to this session, and I hope that you will find this session impactful and enlightening. So today is a very special day because we've been graced by the presence of three great leaders of the African continent who are going to share with us their immense wealth of knowledge around the AU Agenda 2063 and its role in healthcare. All of them have worked with the AU one way or another, and I can't wait to learn more about the AU Agenda 2063 from them. So why don't we get started by knowing our amazing panelists. We have Mr. Simon Touloung. He's a man who has many lucrative hats, and being the only gentleman among the ladies, I would like to give him the honor of going first. Thank you, Mr. Simon, for honoring our invitation to this summit. So just tell us a little about yourself and what you do.
Thank you so much. Thank you so much, Emma. And hello, everyone. Greetings from Uganda. I'm called Simon Marot, and I'm the team leader for the African Youth Action Network. And I'm a member also of the African Union Youth Advisory Council to support, we support the African Union Youth Envoy on her mandate to amplify the voices of the young people on this continent. So I've been with, we have been with her for the last 2 years, supporting her mandate to send about the African Agenda 2063 in the different countries, and also like to send a message about the amazing continent that we have. So I look forward to sharing and learning from you today. And karibu sana. Thank you.
Thank you very much, Mr. Touloung, for that. Secondly, we move to Dr. Chiamaka. Dr. Chiamaka, it was a great experience working with you at the Africa Youth Front on coronavirus, and you did a spectacular job coordinating all the activities of the AYFC to support the joint continental strategy on the response to COVID-19. We are grateful to have you among us today. Kindly introduce yourself and tell us what you do.
Good morning, everyone. Thank you, Emma, and thank you, Simon. My name is Chiamaka Nwachukwu. I am a medical doctor. I live and work in Lagos, Nigeria. I'm a practicing medical doctor, actually. So medical school wasn't too far away. So it's interesting seeing everyone saying I'm from the University of university from this, Nigeria, University of Ibadan, and various universities across the continent. I was part of FAMSA and IMSA not too long ago, so it's good to have all of you here today. I currently support the African Union Office of the Youth Envoy, most recently with the African Youth Front on Coronavirus, which is a platform for youth leaders and youth networks to engage with the African Union to support the work that Africa CDC is doing in terms of the response to the COVID-19 pandemic. So some of the work that we did was to carry out consultations with young people across the continent, of which FAMSA was part of many of, working with FAMSA was a good experience. FAMSA was part of many of these conversations about how COVID had affected young people and how we intend to build back after as we're recovering from the pandemic and economies are restructuring. So that's what we do at the Youth Front. We had released a report, which I will be making some more reference to during this discussion. We had released a report on facts and figures on the Agency of Youth, as well as the COVID-19 recovery roadmap, which is what we as young people are saying to our leaders, that this is what we want as the focus going forward if we're looking at restructuring systems and dealing with the inefficiencies that COVID-19 kind of revealed to us. So that is basically what I do. And thank you once again for having me here. I look forward to engaging with everyone. Over to you, Emma.
Okay, thank you very much, Dr. Chiamaka. Last but not least, we have Ms. Laetitia Badolo. Thank you very much for honoring the invitation and being part of this discussion. It's an honor to have a leader like you with vast experience in many initiatives across different countries and continents as our panelists today. Pourriez-vous vous présenter, s'il vous plaît?
Oh, great French. Thank you very much, Emma. My name is Laetitia Badolo, and I work for an advocacy and campaign firm based in Dakar. So my work is mainly around creating an enabling environment for everyone to thrive. We work across every human rights issue to ensure that rights are respected, protected, and fulfilled. We also work on influencing behaviors and practices to ensure that as individual citizens and communities, we understand and defend our own rights while at the same time respecting the rights of others and owning our responsibilities. And I'm in charge mainly of developing and implementing a campaign and advocacy initiative to drive sustainable changes in policy practices. So, and across different issues like sanitation, health, politics, and also education. And looking forward to sharing my experience and also learning from you.
Okay, thank you very much. Thank you very much, Ms. Laetitia, and to all our panelists for those wonderful introductions. We can all agree that indeed today we have been graced by leaders of great capacity. So let us begin to listen as we learn from them and from each other. So today the title of this plenary discussion is the AU Agenda 2063 and its role in healthcare. Our objectives are to demystify the AU Agenda 2063, to empower healthcare students, to champion for the AU Agenda 2063, and to enable healthcare students understand their role in the realization of the AU Agenda 2063. So we're just going to start by understanding the AU Agenda 2063. And I know some of us may know this agenda, while for some of us, we might be hearing it for the first time, but we learn every day. So I would like Dr. Chiamaka to just tell us briefly what the AU Agenda 2063 is. Welcome, Dr. Chiamaka.
Thank you very much, Emma. So this is an important discussion because it is very important for us as young people. And I'm going to not be talking like I'm within a very a policy discussion, but I'm going to be talking as young person to young person, how we can better understand these structures and champion them in a way that's relatable and makes sense to us at individual, at community level, at student union level, at all of those levels, because we have all these documents sitting somewhere, and the regular young person is not able to understand why this is important. What the thing that I have to say as a background is that the name Agenda 2063 sounds big. We're saying, looking at, there's a lot of policy language, there's a lot of that going on when you try to read through the document. And one thing that a lot of you people would
I think we have lost Dr. Chiamaka, so she will just tell us more about the AU Agenda 2063 when she is back. So we can move on to Simon to tell us the goals and aspirations of the AU Agenda 2063. Simon, over to you.
Thank you. Thank you so much, Emma. And thank you so much, everyone who is joining us and watching from wherever you are, across this continent or outside the continent. So when we talk about the Agenda 2063, sometimes I ask myself, like, why is this agenda not known? Why do we have ambassadors of the SDGs? Everyone is like, almost in our schools, the SDGs are taught. but you will not hear about Agenda 2063. So I think it is a question to all of us young people who are in this discussion that we need to actually reevaluate our contribution to this continent and what we're actually doing to make sure that this continent is stand on its own. So I'm going to briefly speak about the goals for the Agenda 2063 and some of the aspirations that are actually inscribed. So as you all know, maybe some of you have read the Agenda 2063, and maybe some of you have never heard of it, or maybe you are hearing about it for the first time from this call. So the agenda has got like 7 aspirations. The whole goal is to see the Africa, it's called the Africa we want. So by 2063, what do we want to see as African? Or how do we want Africa to look like? That is the goal of the whole agenda. And it was actually passed in 2000, it was actually developed in 2013 when they were actually celebrating a decade for the African liberations in Africa. So the first aspiration is that the Agenda 2063 is looking at a prosperous Africa that is based on inclusive growth and sustainable development. And the goals that are actually being put forward in this aspiration is that they want to see a high standard of living of all Africans. They also want to see the quality of life and the well-being of all citizens in this continent improve. Then if you ask yourself, what do they really mean by standard of living? What do they mean by quality of life improving? Do some of our African young people or the people who are living in this continent, do they even know what standard of living is or what quality of life is? That is the question I think that everyone needs to answer on their own. The second aspiration is they're looking at an integrated continent that is politically united and based on the ideals of Pan-Africanism. So here they're looking at the goals are a united Africa, a continental financial and monetary institution, world-class infrastructure. So these are like just like flat stuff, like they said world-class infrastructure. What do they mean by world-class infrastructure? Do they want us to be flying from, do they want a highway that is flying from Uganda here, where I'm actually joining you from, to South Africa, and well-nourished citizen? So healthy and well-nourished citizen, do we have the institution ready now in this continent that can actually support the aspiration? Do they have the institution ready, the health institution? Like during just the recent COVID-19 pandemic that actually we're all undergoing right now. How many African countries actually have been sending PPEs to other African countries? Or how many African countries actually been receiving PPEs from their own colleagues? Or where do we actually write? The third expression is an Africa of good governance, democracy, human rights, and justice and rule of law. Yes, I'm right now in a country, Uganda. Uganda is actually having their elections next year. And if you talk about this aspiration where they're looking at democracy, values being practiced, they're looking at capable institutions and transformative institutional leadership. And I ask myself, okay, what are these people talking about? The agenda, is it not only known at the AU? Is it not at the grassroots? Because even here where I am right now, people are being tortured. People are being beaten just for expressing who they want or who they want to elect. There is no free and fair. Like you can't even see anything which is free and fair here. And these are the leaders who started in 2013 to draft the agenda, the African Union Agenda 2063. The fourth aspiration is a peaceful and a secure Africa. So here, the peaceful Africa. So one of that's the flagship program, because they had a flagship program for 10 years. So they said for the 50 years to be achieved, they will be splitting the whole program into 10 years. So they will have 10 years from 2014 to 2023. That is actually 2013 to 2023. That is, they have like a 10 flagship program that I'm actually going to mention maybe briefly. And then, so one of the flagship program is silencing the guns in Africa by 2020, which is right now. So 2020 is like some days, actual hours to end. But the gun silent in Africa, or silencing the gun in Africa, is actually more silent than the guns in our continent. And then aspiration 5 is looking at an Africa with a strong cultural identity, common heritage, shared values, and ethics. We're moderating, we're actually speaking right now in English, which is not an African language. We're speaking in French, which is not an African language. So what does the aspiration 5 talk about? Why can't we talk in maybe Kosa? Why can't we be speaking in Zulu? Why can't we be speaking in Igbo? Why are we not speaking Yoruba and have it like known? Why can't we have like speaking Swahili? and maybe have it translated? That's the question that actually we need to ask ourselves. Aspiration 6 is looking at an Africa whose development is people-driven, relying on the potential of the African people, especially women and youth. Yes, we have these young people who are here. We're only speaking on forums. We're only speaking on this. But how much or how far do our impacts actually go? How far do we impact the policies that are happening in African countries? How much do we actually impact on the people that we're actually staying, the communities where we're staying in? Those are questions that we need to answer on our own. If they are saying this aspiration is looking at the potential of women and youth, we have over 220 million young people in this continent. But when there is an issue going on, when there was police brutality in Nigeria, everyone was silent. If the 220 million people were actually saying at least one word, or if maybe the neighboring countries were actually, the young people in the neighboring countries, like let's say Ghana, those who are neighboring Nigeria, if they all march, they just go, they walk towards Nigeria border and say, why are you killing our young people? Why are you killing our colleagues? What change do you think will have happened? I think that will have actually changed the narrative. But because we are saying it's happening in Nigeria, it's not happening in South Sudan, it's not happening in Uganda. Right now, people are suffering in Uganda. The young people are actually hustling in Uganda here. But they are saying, no, it's only in Uganda. The guys in Kenya are just looking. The guys in South Sudan are just watching. In Congo, they are just watching. People in Tanzania are watching. What is happening? So we're not valuing ourselves. Then we are looking at aspiration 7, which is Africa as a strong, united, resilient, and influential global player and partner. Sometimes when I read this aspiration, I ask myself, okay, we started the African Peace Fund in 2018, but how many people contributed to that? COVID-19 happened. How many African countries actually were able to stand on their own? Instead, we rushed to the West, we rushed to China, we rushed looking for grants. Even when the grant was brought in, people started actually corrupting the money. They started actually misappropriating it. So if you really love this continent, or if you really have the heart for this continent, something that is brought from outside, will you be taking advantage of it and put it in your pocket? Or you look at the whole of Africa and ask yourself, how am I contributing to the Agenda 2063? So to me, finally, what I will say is that the agenda is well-written document. It's a well-written document, but it's only in our discussion like this, it's only known in our laptop. We only see it in the laptop. It is not on the ground. So what needs to be done is that there is not a lot of work that has to be done by the young people. And we should not actually give the responsibility to the old people or the people who are in power. We should take up responsibility, put it on our shoulder and say, ask ourselves and say, in 2063, I'm going to be maybe 70 years, I'm going to be 80 years, I'm going to be 90 years. What do I want my grandkids to actually talk about? What do they want? What do I want to hear from them about my contribution to this agenda? Thank you so much. I'm sorry if I've taken much time.
Thank you very much, Simon, for that amazing and elaborate explanation. I'm actually challenged to do more towards the achievement of the AU Agenda 2063. Now that we have Dr. Chiamaka back, we can have her tell us more about what the agenda is. Dr. Chiamaka, welcome.
Thank you very much. I apologize. I was cut off by my internet, and this is one of the things that we need to talk about. And as Simon has rightly said, there's a lot of work to be done. We shouldn't be getting cut off because of internet if we are going to actually get to a prosperous Africa where innovation and technology is the foundation of our development. So our internet should be stable. But that said, Simon has made very important points. And one thing that I like to say is, and highlight from the things that he has said, is that the Agenda 2063 is something that is a document at the policy level, but everybody at every stage has a role to play. So at community level, at individual level, at regional level, at national level, there is a role for everyone to play. And what is a summary of what Agenda 2063 is? Basically, it is a blueprint. It's a document that sets out like a map on what Africa wants to be for the next 50 years. Agenda 2063 was brought into force in 2013. So it said 50 years from now, what do we want Africa to look like? So that is basically what it is. I'm not going to use a lot of policy language because this is a discussion between young people, and we need to make sure that the end of the day, all of our hyperwritten documents are translating to actual change on the ground. This is why I'm trying to explain it in the easiest way possible. So one thing that you have to note, and Simon has already mentioned it, is that countries that make up the African Union now signed to Agenda 2063. So it is not like these countries do not know about it. So because when you read the document, you say, this is such a wonderful document. Why are we not doing these things? It is not because they do not know about it, because this document was sent to all of the countries, reviewed by them, and they signed onto it and pledged to put resources into achieving these goals and aspirations. So countries have signed on to this. And when we're talking about Agenda 2063, we're not talking about it to our leaders in terms of awareness. We're talking about it to our leaders in terms of, this is what you signed. How have you progressed towards it? How are you moving towards this? So countries have already signed to this. Agenda 2063 has 7 aspirations, and the 7 are a prosperous Africa based on inclusive growth and sustainable development, an integrated continent which is politically united and based on the ideals of Pan-Africanism, an Africa of good governance, democracy, respect for human rights, justice and the rule of law, a peaceful and secure Africa, Africa with a strong cultural identity, an Africa whose development is people-driven. And this is important because you cannot say and you're aspiring to an Africa whose development is people-driven when you are marginalizing a whole demographic, which is even the majority. Young people are the majority on the continent. And if our development is to be people-driven, then young people must co-lead these solutions. Young people must be at the table when the solutions are being made. Relying on the potential offered by African people, especially its women. So Africa that is people whose development is people-driven must also respect and uphold the role of women in the society and cannot be discriminating against women and young people. And an Africa as a strong, united, resilient, and influential global player and partner. So those are the aspirations. And this is important because when we are talking to leaders, we need to talk from a position of knowledge, that we are holding them accountable to what they signed on to. Now, there are 20 goals. I think my time is almost up. So there are 20 goals of Agenda 2063. And the first 3 are, related to us because they deal with, 1, a prosperous Africa in terms of job, security, food, and the second is education. So in Nigeria, many young people have been out of school for the past 8 months, and Africa is aspiring to be a continent that cares for its education of its young people. So this is important. And the third is good health and well-being. COVID showed us that there are many inequalities and inefficiencies in our healthcare system which need to be addressed. So this shows that these are the aspirations and goals that exist. There are 20, I can't go through all of them, but these are the goals that exist. Important to note that our leaders are aware of this document. They are aware of this. So it's not from a position of they don't know. So what we need to do is to familiarize ourselves with this and know what is our role to play and how do we hold our leaders accountable. Thank you, everyone. And thank you, Emma. Over to you now.
Okay, thank you very much, Dr. Chiamaka, for that elaborate explanation of the AU Agenda 2063. So after understanding what the AU Agenda 2063 is, the goals and aspirations, it's only fair that we understand why the agenda is important, and that has already been covered a little by the previous speakers. So let's welcome Ms. Laetitia Badolo to shed light on why we are here today, because we are here because the agenda is important. So Laetitia, over to you. Please tell us more. Thank you.
Thank you. And thank you also, Dr. Chiamaka and Simon, for setting a great ground for this agenda. I will just add that this agenda, it's an African agenda, not an institution agenda or a country agenda. For me, it's beyond that. It's our agenda because it will serve African communities before serving the countries and Africa as a whole. It's also a guideline of where we all need to be in 2063 It's not Burkina Faso, Uganda, or Kenya who need to be there. It's me, Laetitia, that need to be there for my children also. And it's a master plan for transforming our Africa into a global powerhouse for the future of our children. And this agenda also poses the basis and also give us specific guidelines to ensure that we are on the right track when doing advocacy, finance, or even research. And it gives us also a room. Dr. Chiamaka and even Simon and Francis on that. It gives us a room. It's not, we are not on opposition with the government or on opposition with our regional institution. They signed it, they agree on that. Now we need to fight. And the youth are the biggest, have the biggest rate in Africa. So we need to be united, to work together and also challenge and push our decision maker to act for better living condition of our citizens. So this is my point to emphasize on the importance of this African agenda.
Okay, thank you very much, Laetitia, for that. I really love the idea of the Africa we want, and it is up to us at individual level and united to work towards the achievement of the goals of the Agenda 2063. So the journey of 1,000 miles begins with one step, and we already have the important agenda with goals that we're supposed to achieve by 2063. So what steps have been taken so far towards achieving the AU Agenda 2063, and what else needs to be done? So let's start by hearing from Simon. Mr. Simon Touloung, you are welcome.
Okay, thank you once more, Emma. Thank you, colleagues, for the elaboration on the Agenda 2063. So what so far has been done, or what is being done by the African leaders on the Agenda 2063? I will just talk briefly. I touch maybe some few things about the flagship programs, because there were like 10 flagship programs that are supposed to be implemented in the first 10 years. So after these 10 years, they're supposed to actually have another flagship program, and then the implementation plan, the monitoring and evaluation plans and everything. So the first flagship programs are an integrated high-speed train network. They talked about an African virtual university. The agenda also talked about a single African aviation market, establishing of the African continental and monetary financial institutions. It's also talking about the creation of an annual African consultative platform, the African passport and free movement of people, implementation of the Grand Iga Dam, that is to boost the energy production in our continent, and then the Pan-African e-network, silencing the guns by 2020, and establishing of the continental free trade area by 2017. So I'm adding the years where this flagship program is supposed to be implemented or launched out, because I want us to actually measure and monitor or evaluate the effectiveness, or how this continent, or how do we see ourselves maybe 40 years from now when we achieve the Agenda 2063. So when what silencing the gun, that is one of the flagship programs that have actually been put. They have put much of emphasis, they have put a lot of energy, they have put a lot of focus in it. And right now, due to the COVID-19, things have not gone very well. I will say there has been something that has been achieved, but not so much, because conflicts have actually been rising now. There are a lot of conflicts that are rising in the continent, and the guns are not silent. Countries that are actually having conflict before are still having the conflict. We still have conflict in Cameroon. We still have a lot of wounds bleeding in Nigeria. We still have a lot of issues in South Sudan. Even in Uganda, as we speak now, there's a problem. Ethiopia, just recently, there is a serious fight going on. And Ethiopia is hosting the African Union headquarters. If you ask ourselves, why do we still fight? Why do we still think that a gun is the source of maybe getting to a peaceful and prosperous Africa? I think that's something that we need to look into. And then establishing the continental free trade area. I think this was, it was supposed to come to forth after 22 member states have actually signed or rectified or maybe submitted their tools for rectification or for accepting to join the continental free trade area. But out of 55 countries, I think only so far there are about 20. Around 20 actually have submitted, and they wanted a minimum of 22 for it to come to force. This was supposed to be done in 2017, but here we're talking about 2020, and this has not yet come to force. So what is happening in our continent? What do we need? What do we really? What can we say has been achieved, or how do we really move from where we are? But I think one or two successes have been achieved. One is the African Center for Disease Control, Africa CDC, which was actually established in January 2015. I think this is one of the achievement of the Agenda 2063 by the AU Assembly. Then there is also the African Climate Change Fund, which was established in April 2014 under the guidance of the African Development Fund. But if you look at the African Climate Change Fund, how effective is it? Right now, along the Nile Valley, there's a lot of flooding. South Sudan people have been living underwater for the last 5 months. In Sudan also, there's been a lot of flooding. How has the African continental, the African Climate Change Fund helped here? We still look to the outside forces. In South Sudan, where I come from, it is the foreign governments that are actually supporting my people. It is the international NGOs, the UN, that are the one dropping food for the people who are suffering from flooding. But we have a continental climate change fund. Who is funding this? How is this funded? How is this being effective? So some of the things that are actually being done are at a very minimal level, actually, because African Union or the African Union is supposed to be like a continental body that establishes the policies in the continent. But the policies are supposed to be implemented at the grassroots, at the member state, at the countries, like at the country level. So when there is no monetary mechanism or when there is no clear compliance mechanism, things go unattended to. So people don't care whether you pass 1,000 policies in African Union headquarters in Addis Ababa, so long as they are not effected or put into the national development plans or put into the national laws, there is nothing that actually goes on, or there is nothing that actually run effectively. So to me, I will not actually say there is a success that has actually been achieved apart from the two: the continental climate change fund, the Africa Center for Disease Control, and maybe the African Education Observatory. But it's still a long way to go. Just like I said before, it's still a long way to go. And for this agenda to actually be realized, we need to actually see more implementation than more talking about the agenda. We need to see people implementing it, people asking the government, you rectified this, you sign into it, what is being done? How are we contributing? Thank you so much.
Okay, thank you so much, Mr. Simon, for that. Let's hear Laetitia. Ms. Laetitia, you're welcome.
Thank you, Emma. I will start from what Simon said. For me, the key step among what have been made is the setting up of this institution, the Africa CDC, to support African countries in promoting health and preventing disease outbreaks. And the Africa CDC plays and still playing a key role in this pandemic that we are fighting, and its role is clearly demonstrated during this period. And on another note, different policy documents have been developed. Countries are trying to align their national programs and strategy to this document with the fast track program and the programs such as the free movement of persons and the African passport, and also the continental free trade area. And I even participate last year as a panelist in youth-led CSO Town Hall meeting on the promotion of the protocol on free movement of persons in Africa organized by the AU. I can list for you all the policy documents produced at regional level: the Africa Health Strategy, the 10-year implementation plan, the alignment to the SDG 30, or initiative probably led by countries. But it will be impossible for me to give you specific achievements in Uganda, Cote d'Ivoire, or Cotonou, directly linked to the AU agenda, simply because I don't know, because we don't see data. Raising then my issue with the implementation of such great, well thought through policy document. Africa lacks data. The capacity of African countries to address healthcare challenges remain hindered by a lack of data coverage. It's difficult most of the time to follow the progress made by our different policies at all stages of evidence-based decision-making and policy formulation. Healthcare, for example. There are no efficient policies without data. We need to improve data collection and also data governance. And I will stop there and waiting for the next session to emphasize on it.
Okay, thank you very much, Ms. Laetitia, for sharing with us your opinion on that. Dr. Chiamaka, kindly share with us how far you think we are in achieving the AU Agenda 2063 and what needs to be done.
Okay, sorry, I was trying to unmute my mic. Okay, so Laetitia and Simon have raised very important points, and they have mentioned a lot of flagship programs. But you know, something important is that these flagship programs have been implemented at very high levels, and we may ask, how does it translate to the everyday experience of young people at the grassroots level and on the ground? And that is really important. So in terms of country progress, not at the African Union level now, because if we're talking about the level of the AU Commission itself, there are many documents, many things that have been implemented, many protocols that have been put into place. The event that Laetitia mentioned that she spoke at, I was at that event last year on the promotion of the free movement of persons protocol. And, you know, we looked at those protocols and we were like, how come we do not know about this? How come it does not translate to the everyday experience of young people? Because these documents exist. So as regards country progress, in February, on the February 8th of this year, a report was released on country progress towards achieving Agenda 2063. And it would just be great to highlight that for as regards progress, the most progress has been made on Aspiration 9, which is key continental financial and monetary institutions established and functional. So we are saying that at different country levels, they have established financial and monetary institutions. But like Simon has mentioned, we have those institutions and the countries are saying we have made progress establishing this. How does it translate? At the end of the day, we're still having to depend on a lot of non-governmental organizations for the young people. So that is something important. And the least progress has been made in Goal 5, which is modern agriculture for increased productivity and production. So in terms of agriculture at a country level, in general, not very much progress has been made. For the first three goals, very modest progress has been made. In some countries such as Burkina Faso have recorded modest increases in rate of primary school enrollment, and we're seeing enrollment increase across many countries on the continent. However, a key issue that has been raised is that yes, enrollment is increasing, but the quality of the education is not about quantity now. The quality of the education being delivered is not at par with global standards yet, because young people are being prepared for a world that is has gone many steps ahead. They are using older methods to learn to deal with a world that is now going more digital and is now depending on in technology and infrastructure. So this is important, that while we can tell you that there are many steps that have been taken, some of them have not translated to the lived experiences of young people on the ground, and this is important. However, these structures exist. So when we are looking for implementation, we are not looking for things outside of these structures. That is important to note. We are saying within the existing structure, within the African Continental Free Trade Agreement, within the Africa CDC's work, within the aspiration to the goal to establish, an Africa Innovation Center, what are the ways we can hold our leaders accountable to implement these specific areas? Thank you very much.
Thank you very much, Dr. Chiamaka, and all our panelists for sharing with us the progress we've made towards the attainment of the Agenda 2063 and the challenges, and we can all agree that we have a long way to go. So it's up to us to join forces and work towards achieving these very important goals for the good of Africa, to get the Africa we want. So we move on to the second part of our discussion, which is the African Union Agenda 2063 and its role in healthcare. So one of the goals of the AU Agenda 2063 is to have an Africa with healthy and well-nourished citizens. But currently there are gaps that exist, and these gaps need to be filled. So Ms. Laetitia, please tell us what gaps needs to be filled by then to ensure the optimum health of the people of Africa. Welcome.
Thank you, thank you. For me, there are three main gaps that I think are the most important. The first one that I was talking about, the data gap. On the continental level, I would say that the AU did what it could. We have a pretty clear outline of where we all need to be in terms of sanitation, security, finance, and of course, health. The regional level now must play this coordination role. How can we ensure that in addition to the AU organ, we have our regional institution monitor and track all the progress made by the country part of this regional institution? And I come back to my initial issue. There is no enough data to track these results. The challenges and these challenges, for example, will allow to recalibrate if necessary, or to change even the different choices made by the country or at the regional level, and why not even at the continental level. Where there is data, it provides valuable insights. At national level, data management will allow countries to better manage surveillance system, the disease types, the mortality rates, and even if each country faces its own challenges and unique context, it requires tailored solutions to improve program performance. And with data visualization technique, it will be also possible to identify clusters of these health challenges as they are indicators of interconnected issues for families affected by them. At the community level, CSOs, CBOs, faith-based organizations need also to hold all partners accountable for their commitment, ensure that the management and the delivery of health services are shaped by and responsive to the needs of individuals and communities. Also, the various institutions like the research institution, development partners at regional and national level can also work together to avoid duplication, build on complementarity and also maximize impact. The other gap for me, it's around the system and the financing one. We continue to facing system failure. We have the chronic malnutrition, maternal health, the NTDs that affect our children, trachoma that affect, for example, the blindness and visual impairments. We have fistula, for example, that limits women's ability to achieve their full potential. For me, maternal health and child health are compulsory and central to achieving this UHC. With this purpose, African structural transformation. When I was preparing this panel, I read the Ibrahim Mo Index on Africa governance on UHC. And they develop an analysis of the UHC coverage in Africa, and it highlights the growing dissatisfaction with how African governments are handling improving basic services. And this went along with the financial gap. The percentage of aid given to the development of healthcare system and non-communicable diseases is significantly less when compared to the aid given to specific targets of combating communicable diseases and maternal, newborn, and child health. And This index also show that there is significant progress. Dr. Chiamaka even gives some example in Burkina, even if it's small. So with these targets and indicator of the SDG, for example, goal 3 to ensure healthy health, the agenda aspiration 1 around healthy and well-nourished citizen, we need to measure those progress, but it's not enough to achieve UHC. The last gap for me, it's around synergy. You know, any advocacy process, it's a process of change. And process means patience, understanding the context and the communities. And to understand, to reach those different elements, we need to have a synergy of action of different group of actors that are working for health, but contributing also on health to work together and have a cooperative initiative in health system governance on the continent that will strengthen the impact and also limitate the failures. Thank you.
Thank you very much, Ms. Laetitia, for that. So there is need to strengthen our data coordination, our research and development, our systems and financing for health and maternal and child health systems, and above all, we need synergy in all this. So we move on to the next question to Dr. Chiamaka. By 2063, Africa aspires to have well-educated citizens and skills revolution underpinned by science, technology, and innovation. So, Dr. Chiamaka, having been trained as a healthcare practitioner in Africa, what do you think needs to be done differently in the training of healthcare professionals to make this a reality? Welcome.
Thank you very much, Emma. And you have raised a point which is very dear to my heart and makes me equally sad and angry at the same time. In my country, Nigeria, students have been home since March. Many students in medical schools across the country have been home since March. And I come from a country where we already have a healthcare worker crisis. We do not have enough healthcare workers. Um, I work full time, so I can tell you the amount of work I have to do. I leave work late. I know Emma would say sometimes I don't respond to emails because I am working. We have a healthcare crisis and a large group of medical students who can be contributing to the workforce at this crucial time is being kept at home with no plans, no concrete plans as to when they will be returning to school and when their education will continue. It is a terrible situation and it is very painful. Young people are angry, upset, and annoyed with what is currently going on. And I know that many other countries have different stories, maybe not as grave, but similar stories of disruptions in education, poor facility, poor infrastructure, um, teaching that is interrupted, and sometimes not being able to compete on a global scale because you see some things in textbooks, you see some, oh, we can run so and so investigations, but you never actually see it being done. And it is a problem. So during our engagement as the African Youth Front on Coronavirus, and thank Emma and Kapil, I see are here, FAMSA and the Southern Africa Youth Forum organized several consultations on education and what needs to be done in terms of improving education. So I will start from there because as a whole, we need to improve educational systems in Africa before we can even translate to medical education, because that is a specialty that requires a lot of attention, a lot of financing, and a lot of investment. So this is what young people have said they would like in terms of education. First of all, to increase national budgeting for education and accelerate the development of e-learning systems. So many institutions try to migrate to e-learning systems during the pandemic, but it couldn't work because it was new. They were not used to it. This is not something that they had been doing often, and it did not was not as impactful as it should have been, as opposed to countries where they already had a lot of work they were doing online, so it was easy to just make everything online. So that is something that we must invest in as a continent: e-learning, digital infrastructure for young people, and training. So it is not enough to invest in digital infrastructure. Our lecturers, our teachers, faculty must also be trained in the way to use digital infrastructure properly to accelerate education at especially at medical school level. Then the second thing is to establish multi-stakeholder partnerships to invest in technology that facilitate digital economy. So we're saying that the government cannot do everything, and this is important for us to learn. So we must collaborate. We must collaborate with technology companies. We must collaborate with people who provide systems. We must collaborate with training institutions to put together something that is well-rounded and robust for the education of young people on the continent. The next thing that young people talked about is to establish African centers for innovation and excellence that can match education with market needs. And this is important. So if you are learning 20th century medicine or nursing or physiotherapy, you cannot compete in the 21st century world. If we're still basing diagnosis on investigations that are only useful, that were useful 100 years ago, you cannot compete. So this is important that we are updating our guidelines all the time to be able to make sure that the medical students, the nursing students, all the students that we are graduating can fit in a world in the 21st century. And then we should, young people have also asked that we should criminalize undue restrictions to internet freedom and internet shutdowns. And this is important because in the 21st century world, it is out of place to say that for a whole week or a whole month, young people or people are not able to access the internet, which is now a foundational tool in learning. This is important. And something that I would also like to add is that there needs to be more priority placed, especially in medical education, on improving the other living conditions and all the socioeconomic things that are around the student. So you cannot say you are delivering world-class education when students do not have access to good accommodation. Every student should be housed within the facilities, because students having to find their own facility for accommodation, students having to think about food, it will not allow them learn at the rate that they are supposed to learn. So these are the things that you have to also take care of: the emotional, the physical, and social well-being of the students, to make sure that they are able to learn properly. Because if we're saying that our continent is dealing with a healthcare crisis and you are not training students completely, because they cannot learn if they are not taken care of in those other ways, and you're not training students completely, that means that we are not going to be out of this healthcare crisis in the next 50 years that Agenda 2063 has stipulated for us to get to that point. So this is important, and I have mentioned digitization, an increase in investment, collaboration between various systems, as well as dealing with the physical, mental, emotional well-being of medical students, of students in general, to make sure that they are learning, and then finally to make sure that the learning that students get and young people get is at par with current global standards. Thank you very much, and over to you, Emma.
Okay, thank you very much, Dr. Chiamaka, for that. It has been very, very insightful. So yes, we actually need to increase financial allocation to education, and as well as embrace technology, and have multi-stakeholder partnerships to improve education. And we should prioritize the medicals. We should prioritize medical or healthcare education in a wholesome manner, taking care of the social, physical, and emotional aspect of the learners. I can't agree more to that. So we move on to the third question to Mr. Simon. So 2013 marked the start of the 50 years in which Africa is supposed to be working to achieve the Agenda 2063, but in 2019, we have this COVID-19 pandemic that emerged, and it has had a lot of negative impacts on various things. So what challenges has the COVID-19 pandemic posed to the realization of the goals of the AU Agenda 2063, and how can we bounce back better? Over to you, Simon.
Okay, thank you, Emma. Thank you, Dr. Chiamaka and Laetitia, for all the input. I think I will just be adding like some few things like in line with the Agenda 2063 aspiration, the first flagship programs, the first 10 years plan. To me, you see, this pandemic has actually, it has been like I will say it's like two things at a go. So there are a lot of challenges that we as a continent actually went through. But to me, actually, there are a lot of things, a lot of gaps that we can actually learn from. A lot of gaps that are actually been exposed by this pandemic that we can actually take advantage of and actually use to our advantage. So, for instance, this year marks the end of the Agenda 2063 silencing the gun program, because we are supposed to be silencing the gun by 2020. You know very well that we can't have the structures when there is war. We can't have the structures when the guns are always like outside there, like all the time. The guns are outside there. People have been killed and people are all running out of the continent, saving their life. So we can't have the structures. We can have the internet, but when people are when the internet is just flooded with people who are dying everywhere, what will happen? It will still continue like making our mental health, like our state of the mental health to actually be what worsen, because when you see dead body every time, your mental disturbed or you are traumatized. When we don't like have a peaceful Africa, we cannot have the continental free trade area come to force. Why? Because who will be trading with who? How will you be taking the goods? Which boundaries are you going to be using? I've been locked in this country for the last 8 months in Uganda. I cannot even go to my country, South Sudan. Why? Because of this COVID-19. The buses that are being like transporting people have all been stopped. What caused that? The goods, like the movement of goods, have also been stopped, because South Sudan depended so much on Uganda for high economy. So a lot of things move from South Sudan, from Uganda, from Kenya, from Ethiopia to South Sudan. All these have actually been put on a hold because of this COVID-19. So this has actually challenged the achievement of the agenda in such a way that there are so many programs that were supposed to be actually launched, so many programs that actually were supposed to be monitored and followed by the head of states or by the African Union Commission Secretariat. But all these things have not been achieved because of the restriction in movement. So what does that tell us? It tells us that there are a lot of things that are a weak point. So they talk about infrastructure. Let me talk about one of the flagship program, which is the Africa Nice and the dam that was supposed, the Grand Iga dam project. So when we have an energy sufficient Africa, what do you think can actually happen? How does that really translate to the health and the well-being of the people of the continent? I'm studying here energy economics and governance, and I'm looking at how we're actually missing out on how health can actually be achieved through an Africa that is having affordable, accessible, and reliable energy system. For instance, in a country like Uganda or South Sudan, if you go to a medical hospital, if there are power blackouts, how many patients die because of they cannot have oxygen? How many patients die because they cannot have like a successful operation since there is no energy in what being supplied in the hospital? I come from a country called South Sudan, where if I take a patient to the hospital, I have to be the one buying fuel to actually fuel generator. I have to be fueling the generators to actually to provide power for the hospital. This is a national hospital. So if a national hospital cannot be powered by the whole government, and they are waiting for people who have passion or people who have like people referred to also to forward the whole hospital. What does that tell us about the continent? They're talking about an electric train that is connecting most of the African cities. We're talking about electric train when actually African cities are still in darkness. They're still dark. Okay, sorry. They're still dark. They're still very dark. Actually, they're in darkness. There is no electricity connecting them, but we want to connect them with electric train. What are we dreaming of? So if that actually has been actually cheap, or if that was actually a success, you will see that transport will be very easy. If there is a patient that is actually maybe doing Badolo up in Sudan, in Kenya, in Uganda, they can rush him out to South Africa. They can rush him to Zimbabwe. They can rush him to Botswana. But that is not possible, because for me to move from Uganda, if I want to go to West Africa, I first move outside the continent. I'll first go to France, or I go to Amsterdam, and then I connect back to the continent. What does that tell you about our system of transport in this continent? It tells you that there is nothing being done. And because of this COVID-19, you cannot say, let's have roads constructed. Let's have, people are not surviving. The African leaders are actually surviving. But the good side of this COVID-19 is that since it has now made movement impossible, it has now even forced our politicians, the people who actually, the policymakers, to actually go to our whole hospital and actually know the condition of these hospitals. Because they have not been attended in this hospital. They have been in France, they have been in UK, they have been in Germany, they have been having their medical attention in India. They have been everywhere across the world. But now everyone is saying, use what resources you have. So it's time for Africa to open their eyes and build the African infrastructure, build the African hospital, build the road network, build the energy sufficient continent using the resources that we have. Because it's not because we don't have the resources. Finally, I think what I will actually say for us to bounce back is, first of all, if we are going to be talking about the education system, reviewing the education system, putting money for the education system, do we have the people that actually are going to stand, or who are going to be following every single coin that has been put into that system? If we don't have that the people in that continent, the human resource or the manpower that is supposed to actually take care of the education system or the reviewing of the education system, then we shall always be talking, everyone, because this is not the first time people are talking about change of the education system. It has been there 30 years, 20 years long before, 40 years before, and we are still talking about the education system now. If you go to African families who have kids like maybe 15 years, 10 years, or 7 years below, what do they watch in the evening? What do they do in the evening? You'll find they're busy watching TV. They're watching a Z-World. They're watching Indian movies. They're watching all these movies. But we're talking about changing education system. If you cannot change the way your kids are actually learning in your own house, how do you expect a teacher who is outside there to actually change them? Because they will be watching, okay, they will be watching Z-World at night. For them in the school, they will be telling them about changing. Maybe coding, they will be telling them about Python, they will be talking about coding and programming in the computers. But at home, they are busy on TV. So if we cannot change the African people, then who will be the one actually championing the change in this continent? So it's up to us, the young people, to actually change the narrative and say, look, this is the education system I want my kids to learn. You practice it in your own house. What change do you want to see? Practice it in your own house. Practice it with your nephews. Practice it with your grandchildren. Practice it with your brothers, your sisters, and your siblings, so that when they go to school, they will be able to question. Because our education system, the only problem is that it's more focused on examination. People want to pass. They want to get the certificates. That is the biggest problem. How do we change that? It has to be from our parents. We change our own expectation. If we have a brother who is studying, we don't ask them, why are we not in Division 1? Why are you not in grade 10? Why are you not in among the first graders? We tell them, if they are passed, we push, we keep on telling them how we're actually happy about what they have. If they have a passion maybe in other industry, we don't push them to be doctors. If they want to be a musician, let them be musician. If they want to be engineers, let them be engineers. We don't push people. We don't actually see what we want to see in us, what we fail to achieve as parents, and then we want to put it in our kids if we want to change the education system. Because once we raise those kids who are able to question, even if they go to school, they will be able to raise questions. They will know that their parents and their relatives are actually on their back. Because even if the teachers question, even if the teachers throw them out of a class, they will come home and we're on their back and say, yes, what we did was very good. But when we have a question, we have parents that are raising kids that are not questioning. Even if we change the education system, they will still go back. They will still revert. It will take us more years to actually change it. So let's practice what we are talking about. Let's practice what we want to see in this continent. So COVID-19 is a big issue. It has affected a lot of programs. Everything has been put on hold. A lot of meetings, a lot of continentals, policy signing, policy drafting has been put on hold. But it also shown us where we actually need to come in as Africans and where we need to actually have our issues addressed. Thank you so much.
Okay, thank you so much, Mr. Simon, for sharing how we can use the gaps that COVID has exposed as learning points, and war, infrastructure, we really need to improve on that, because it's actually crazy that to move to another African country, sometimes you need to go to Europe, then come back. It really doesn't make any sense at all. Yes, we really need to invest in our human resources, and it's up to me and you, us young people, to change the narrative. And the education system has been a constant problem, where we have rote learning, which does not really address the market needs and so on. And that is mostly because we have inherited the education system of the West without evaluating our market needs. So there is really a lot that needs to be done in the education system, and me and you are catalysts of change. So let us think about that as we continue to work towards the achievement of Agenda 2063. So an important point to note is that healthcare students from different parts of the continent are gathered here today to take part in this session. And we would like to know how healthcare students can contribute to the realization of the goals of the AU Agenda 2063, both at individual and organization level, and if there are any such opportunities in the African Union. Dr. Chiamaka, we would like to hear from you.
I'm sorry, I lost you for a bit. Can you repeat the question, please?
We have healthcare students from different parts of the continent gathered here today, and we would like to find out if there are any opportunities for contribute the AU Agenda 2063, and if there are any such opportunities in the African Union.
All right, thank you. That is a very important question, and it's one that I get often. So I'm going to start by reiterating something I said at the beginning. Agenda 2063 is a blueprint, hence it translates all the way down. So you do not, the first thing that you need to know is that you do not have to work in the African Union to implement Agenda 2063. I know many of us are more familiar with sustainable development goals, which are great, but Agenda 2063 is ours. So the same way we have talked about the SDGs and, you know, implementing the SDGs at our own different community, individual, small group level, that is the same way we need to look at Agenda 2063. It is something that each of us has a role to play at our level, because we're saying we want to improve education. So if you are running a small school for children within your community, you are contributing to that goal, you're contributing to that aspiration. So it is something that everyone has a role to play. And I'm a big proponent of doing what you can within your own community. So that's the first thing, within your own community, within your own small group, within your own MSA. I know there are a lot of MSAs here. Within your own MSA, what are you doing as a Medical Student Association or Nursing Student Association to contribute to the development of the continent? So that's the first thing. Now, within the AU, what are the programs that exist? I know I can only speak confidently on youth because that is where I work. Maybe Simon and Laetitia have other information, but I know there's the AU Youth Volunteer Corps, where young people who apply and are selected, are trained, and then posted to various departments within the African Union to learn, you know, how this works, how policy is implemented, how the programs are structured. So that happens. I think that the cycle for 2020 is done, but there's a cycle each year. I work with 2 AU YVC members at the AU Office of the Youth Envoy, and they are excellent young professionals, and they're learning so much working with these various offices. So that is one opportunity. Another opportunity is that, you know, periodically the African Union sends out calls for different areas with which they want to work with young people. So there is the Salima Youth Victorious Ambassadors, who are ambassadors to advocate against female genital mutilation. There's the African Youth Charter Hustlers, I think that was announced. The people who were selected were announced yesterday. So they are young people from all of the countries of the continent who would be advocating for the ratification and implementation, especially of the African Youth Charter at their various countries. The third that I know of is the Africa Women Silencing the Guns Fellowship. So there are all of these opportunities. But one that I know which is big and established and happens every year is the AU Volunteer Corps. I know Salima has been started now. The Youth Charter Hustlers has been started now. There's currently the Africa Youth Ambassadors for Peace. So there are many areas. The African Union current puts out calls for these various areas for young people to contribute in various ways. But most importantly, what are you doing at your own level? That is one thing I have to emphasize. You must not work at the AU, because the truth is that for you to say there has been progress at the continental level, that means there must be progress at local, at community, at regional, and at national level. So what are you doing in your country? You can hold your leaders accountable. You can I know there's an NGO that I follow, Budget. What they do is that they examine the documents. So if a state has said we spent this amount of money, so Budget examines how much was spent, how much was allocated, how was the money used. Basically, an NGO to track accountability of governmental agencies, and this is very important. So you can look at all of these various areas. Not all countries will have the same opinions. And even from this panel, you can see that we're talking from different levels. Simon is from South Sudan, lives in Uganda, so he understands very much the impact of conflict on young people, and he will talk from that context. I am in medicine. I was a medical student not too long ago, so I understand what it needs to be done within my own context. So we all have different roles to play. And it is important to identify the major issue within your community that you can solve using the blueprint that Agenda 2063 has laid out. So thank you very much. If you need more information, I know au.int has all of the information on all these various opportunities for young people to contribute directly. But most importantly, do not forget that you must contribute at local, regional, community, and national level. Thank you very much, Emma.
Thank you very much, Dr. Chiamaka, for that. So we all have learned that each of us has something to contribute. So it is up to us to contribute wherever we are, whether we are working with the AU or not, because all these efforts at the end of it all, they're the ones that make the difference. So we move on to Miss Laetitia. Miss Laetitia, please share with us opportunities that young people can participate in that can help in the attainment of the goals of the AU Agenda 2063.
Thank you, Emma. I will say that they need to have a broader vision than only caring. They must be actors of change. I know it's important and even compulsory to master care techniques, anatomy, psychology of the patient, the right dose to administer the drug that will affect at such time to resolve such health concern. But the health coverage of a village, a city, or the country is not limited to the care provided. Simon urged us to better educate ourselves beyond school or university curricula. They need to know the health and nutrition policy of their country, the decision makers, and then consider how they can contribute in defining the maneuvering option that the mandate as a health professional allows them to have. Keeping in mind that beyond their role, they hold people's life in their hands. And for this, it must not only limit it to the care room, the hospital, or even the home visit for a vaccine of health monitoring. They need to be part of all the value chain to ensure healthy life of the population. They must contribute to improving policies at national level to make them more inclusive, because they are the more aware of certain realities on the ground. They need to contribute also on changing behavior of the population they are working with to better manage their own health by giving them, for example, simple acts that they can do to ensure the families, the children, the health coverage it's really monitor. They also need to contribute. I know Dr. Chiamaka insists on the fact that you don't need to be part of the AU, but the AU Youth Envoy, for example, provides some spaces for youth students or youth organization to challenge the AU different programs. So by joining some initiative, not to work with the AU, but by joining some initiative, they can challenge, because health and education, but I will insist on health. Health, it's really critical for the advancement of a country, for the improvement of the country, for the quality life of the country. So I don't want our healthcare students to limit the contribution to just caring, to just providing drugs. It's really beyond you. You hold my life in your hand. When I go in the hospital, I went there because you provide me the right drugs, you give me the right instruction. I won't take, I don't know, I won't take paracetamol to solve, I have, I don't know, I have, for example, diarrhea. You want to give me insulin to solve diarrhea because you know what to give me. So I don't want them to just say, I'm just a nurse, I can do something, I can go and challenge my director. You can, because they signed to make sure that we live a healthy life. So you have this guidance that the agenda gave you. You have your mandate as a health worker that gives you all these realities. You know the ground, you know your patient. So don't limit yourself to the caring. Be an agent of change, be a change creator. Thank you, Emma.
Okay, thank you very much, Ms. Laetitia. So Ms. Laetitia has actually challenged us to actually expand ourselves beyond the classroom, so that we get educated, not schooled, because education is often confused with being schooled. Being schooled is about going to school, going to class, sitting assessments and passing the assessments, but being educated is what makes the difference. So let us all purpose to get educated on different aspects. Let's all go through the health and nutrition aspiration of the AU Agenda 2063. Let us educate our colleagues about that. Let us join forces as we purpose to contribute to the attainment of the AU Agenda 2063. Mr. Simon, please share with us what you think young people should do to contribute to the achievement of the AU Agenda 2063.
Thank you, Emma. Thank you, colleagues. To the young people who are listening and watching, yeah, we're hearing you. I'm actually following the comments from here. Some of you are saying it's the first time that you are coming to know about the Agenda 2063, which has been there for the last how many years now? Like 9 or 7 years. So it's right time you go to the internet or go to the African Union website, download the Agenda 2063, read the agenda. Don't understand it using the policy terms that are actually used there. Translate it into your own self. Put it into your own family and say, how do I put this agenda on the table here as maybe Chiamaka or maybe as Emma? How do I put it into practice in my own house? That is the first thing. So knowing the Agenda 2063 is the first role that you need to actually do. Second is that we have talked here about the use of data. We have talked here about the uses of research. So as someone who is actually into the health paternity or the health department, what do we need to do? Whether you're in school, you are in a hospital, are you able to actually go even beyond the work that you are doing and write data, like conduct research, go and interact with your family people?
Simon, are you with us? I think we lost him, but he was saying that the most important thing is for us to know the AU Agenda 2063, and it's all available in the AU website. So please, after this, make a point of visiting the website, going through the website, and make sure to download and read the AU Agenda 2063. And after reading it, don't keep it to yourself. Share with a friend, share with a brother, share with a sister, and so on. So I will move to the Q&A. I see a number of questions that have been asked, and the first is political will has a great role to play in the Agenda 2063, and how can you advise we young ones about the future? How can you advise us about how can you advise we young ones about the future and what we can do to improve this? So the person is basically asking what advice can be given to us with regard to how political will affects different things and how it has a great role to play in the Agenda 2063. Dr. Chiamaka, would you like to answer that?
Thank you very much for the question, and hopefully, if Simon is able to join, Simon has done a lot of work in politics and youth advocacy, and he will probably also be able to give some insights on that. I will just share from my own experience. So the first thing is that we have to understand that the way our continent is set up, and many of our countries have been set up, we are not going to be able to get the things we want easily. It has to be continued advocacy, holding our governments accountable, speaking out, going to the meetings that matter, and saying this is what is supposed to be done. Why are we not doing this? And then it also comes down to personal and individual accountability. So, in different spaces, like we were talking about something in my country, and then, in different spaces, we are complaining about the bad, we're complaining about how bad things are, we're complaining about this, complaining about that. But the problem is when elections are near, when it's time to elect new leaders, we start seeing people sell out in quotes. We start hearing stories of people who got young people. I'm not talking about old people now, young people who have taken bribes or kickbacks or whatever to sway the elections in particular favor of a certain candidate who, after winning the elections, will not care about the well-being of young people. So at the end of the day, it is now a vicious cycle that we complain, complain, complain. When we do get the chance to do something about it, we are not able to do anything about it. So now political will is not going to be easy to get. So the first thing that I have mentioned is continued advocacy. And advocacy can come in many ways. You can advocate by speaking out about it. And let no one tell you that social media campaigning is not important. We have seen Twitter spark movements across the continent and across countries. So it is nothing is too small to start up. One, advocacy, continuous, not getting tired. Two, when you do have a chance to meet with those leaders, go and speak to them, go and present your case, hold consultations with young people and talk about it, talk about it, talk about it. The third thing that we have to do is that there is power in our ability to vote. This is why many times a tool against democracy is taking away that power from young people. A lot of our power lies in our electoral and our democratic process. And while I know in many countries on the continent, it is dicey, when young people decide to rise up to stand against it, we are able to make change. So one thing that we have to remember is that since there is power in our vote, one, people who do not want progress of the country would want to stop you from even registering to vote. So one thing that has come up in my country is mobilizing people to vote, mobilizing people to get their voters card, mobilizing people to be able to have the power to vote. And then when it is time to vote, what are you voting based on? Are you going to allow someone to buy your vote and then put your future at risk? Are you going to allow someone to talk to you about things that they will give you in the now, but do not have any plan for development or your well-being going forward. So this is very important for us to learn. The next thing I would like to mention is that someone asked, it's not a question that's been asked, but I'd like to talk about it. He said, I heard a lot about starting somewhere, being the change agent and making the first move. Please, can you talk about how to do this practically? This is very important to me because I do not come from a policy background. I'm from a pure medical background, but I've been able to be in rooms where people who studied something related to social development have been able to get into. And it is simply because so many of us have small student groups. Let me start with Medical Student Association because that is what we are most familiar with. So your Medical Student Association, what have you done at that level? So if you're going to do a community, I know some medical students associations that adopted small communities as their project. So they said that this community, every year, we will go back to them with immunization, we will go back to them with educational awareness, we will go back to them with this and this and this and that. And you will see the progress in that small community that they have adopted. So that is a way of starting small and within your community. Not everybody is going to work with the UN or with WHO or with Africa CDC, but you can make considerable impact within the community that is just around you. Does the community around you have access to clean water? Do they know about malaria and how to use insecticide treated nets? Do they know about all of these little things? What can you do to improve the processes within your small community? You may be in a teaching hospital and then you see that, okay, the way waste is being disposed of is not proper here. Making a small flow chart and putting it up within, on the wards or within the call rooms, that this is how to segregate waste and all of that. That is something small that you have done. And document all of this. As you document all of this, you are going to be able to be put in charge of bigger programs and projects. And that is literally how it is. Do not be afraid of starting small, but also think about how you want to impact on bigger scales. So I hope I've been able to answer these two questions in the most practical and realistic way possible. Thank you, everyone, and thank you, Emma.
Thank you very much, Dr. Chiamaka, for being so elaborate in your answer. We move on to the next question. I'll just take one more because of time. So Abdul Basit has said, great discussion so far. I understand that the Agenda 2063 has its aspirations, goals and priorities, flagship projects, etc. So, which is good. And also, as slow as Africa has been, we can all agree that not all African countries are at par in terms of development, hence the need to domesticate this agenda in each country. So his question is, what has the AU's effort been to assist AU members in domesticating this agenda? Laetitia, would you like to answer that? Laetitia or Simon, any of you can answer.
Okay, I will start and Simon will reinforce it. I will start with the last question, the previous question before I jump to this one. In terms of advocacy effort, for example, that students need to, or health worker need to have to educate first themselves on advocacy. People tend to have their own understanding of what advocacy is, but advocacy, I won't say it's a science, but it needs to be learned. You need to know how to analyze your decision maker. You need to know how to analyze the power of influence. You need to know your theory of change. You need to know how to choose or how to identify your advocacy targets. And all these elements, even the research part, you don't do research to do research. Your research or your change should be specific to what you need to achieve for your community or at the national level. So you need to educate yourself to build your capacity on advocacy, and there is ways, there is room. There are some organizations that are offering modules or even physical training on advocacy. They need to build their capacity on that first. And after, with the community, they will see, okay, according to to what I know on health or what I know on advocacy or policy, which angle I will use. Maybe policy change, maybe practice change, and then roll out all your advocacy plan in order to reach this objective. And make sure you organize activities that are specifically linked to the change you want to achieve. So I just wanted to emphasize on it, because people sometimes have they said advocacy without knowing all the component, the elements, all the value chain you need to incorporate in advocacy. And jumping on that question, please, can you remember me the question? I lost my point.
Okay. So the question is, what has the AU's effort to assist AU members in domesticating this agenda been?
There are some initiatives like the NEPAD. So NEPAD is leading, for example, the Africa Health Strategy, I think 2016 to 2030. So they have this master plan of how can we strengthen the health policies, the health infrastructure, the health program in Africa until 2030. And not only the agenda, but the SDG 2030 also give us some not some tips, but some commitments, some guidelines in order to achieve all these health program. And by joining some initiative lead by NEPAD, for example, who is, for example, working a lot in Senegal around making sure that even sanitation program are part of the national initiative, and some organizations that are linked to the AU. So I think those can be some initiative, and even WHO at country office is making sure that the country program, while reaching the SDG 2030, also reach the overall goal of the continent. And I will let probably Simon reinforce on it.
Okay, thank you very much, Ms. Laetitia, for sharing your insight on how to be, on what to do regarding research, advocacy, and how the AU has been making efforts to assist members in domesticating the AU Agenda 2063. So let's hear from Mr. Simon Touloung. Simon, you're welcome.
Okay, thank you. I think Laetitia has done a lot of good work on this question, on what the AU is actually doing. Most of the thing that the African Union does is just building the capacity of the member state on how they can actually domesticate agenda, on how they can, what benefit they get when they rectify the policies that are passed at the AU. So for instance, Africa CDC is now doing a lot of good job coordinating with the different African nations to actually get to know about the COVID-19 status, how they are actually responding, and how the AU can actually be of support to the whole response. So to me, I think that is one way that the AU is actually helping in making sure that this Agenda 2063 is actually localized or domesticated at the member state. So this is the policies. So the policy now, they use the different AU organs to actually go through the regional economic communities, through the different secretariats, through the different bodies that are actually in the AU to actually talk about the agenda, meet the policymakers in the different nations or member states, so that they can actually domesticate and put it into their national development plan. So I think as African, what we can actually do is, I've just seen like one brilliant idea from one of the young people here in the chat room. I think it is Abdel Sabit. I think it's from Abdul Basit. Abdul Basit is saying we can actually be writing about the agenda and put it in the different magazine, different journals, so that the young people actually get to know about it. Yes, I think that is a brilliant idea, and you can also use the social media platforms. can use stories, we can use different tools, cartoons, things that actually interest the young people. So instead of following Manchester United or Liverpool, they can actually be reading maybe a column about the Agenda 2063 in one of our papers. Or we can actually go to meetings like this, even if it's not about the agenda, but we can actually maybe be sharing links. We can talk about the organizer and then be sharing links. So the other thing where they talked about advocacy, to me, advocacy, we do it in a way that sometimes we end up being worn out because we only have the hearts to help, but sometimes we don't know where to get the support, like the tools to actually help us in our advocacy work. So when we're able to actually know, if we're able to have like resources that are actually put together so that you can go and learn, you can go and if you are in peace building, if you're able to be connected to Simon and say, you know what, I'm doing peace building in Cameroon, how do I go about this? That can be one way that we can actually push for this agenda or advocate for it at our local level. If someone is into health and there are maybe health issues, are you able to actually come and we sleep together? We can share a room, share a bed, share like maybe university halls, and then you volunteer in a country like South Sudan that is actually struggling with no healthcare. You can go and actually be in Cameroon where people are actually struggling with healthcare in the region that is actually having conflict. So these are things that we can do, but it will also require us to have our own resources. It will also require us to actually have our own manpower, because if we say, okay, I'm leaving South Africa and I'm going to maybe join people in Botswana, it will only be you. The government will not act. It will be you to use your own resources, to use your own power, because it is not everyone that is crying with us that is part of us. Some of them are just crying to make us feel as if they are part of us, and yet they are actually not with us in this struggle. So we have to actually learn to stand on our own feet. The other thing is, we should not strive to be conventional, like following whatever has been done or how people are doing things in the world. We can actually devise our own means. We can have, so long as it is original, so long as we know it is right. Let's strive to do the original things, not conventional things. So if we follow things, we'll just be coughing and or maybe imitating or copying and pasting what is happening outside. We put in our context, which is so much different. Because how can you tell me that you want to actually have like an online learning in Uganda when even half of the population is not connected on the internet? Just right now, I've been struggling to connect to you guys. So how do we actually devise and look for a way or maybe method that actually that can be locally owned, locally managed, and locally operated to actually help us in responding? We have clean water, we have a lot of green cover, a lot of natural food, but we're eating a lot of meat, which is killing us. We're eating a lot of things that are actually killing us. We want to go and get pizza. We want to go and get McDonald's. We want to be in KFC and take pictures in KFC. How do we tell people that, you know what, it's better for you to take pictures in your farm when you're eating an orange than being in KFC, taking like a plate of burger or chips, which is actually going to be harmful to your health. So thank you.
Thank you very much, Mr. Simon, for that. It indeed is very enlightening. So thank you very much to our panelists for that eye-opening discussion. It has been very, very impactful to me, and I hope that everyone else has been impacted. So it's important for us as healthcare students to recognize our roles and our contributions to the attainment of the Agenda 2063 and work towards them. We have also learned about the challenges that are going on, so we should also join forces to overcome these challenges to make it a reality. To our attendees, we have benefited from I hope you have benefited from the discussion, and thank you for being part of this discussion. So I will hand over to Mashkur. Mashkur, thank you. And yes,
Thank
thanks
you.
everyone. Asante sana, merci beaucoup.
Emma, I think there's one more question.
Okay.
There's one more question.
Yes, there's one more question. How can we attract foreign investments into Africa to invest in developing digital platforms for e-learning? How can we attract foreign direct investments into Africa in developing digital platforms for e-learning? Which of our panelists would like to answer that?
Okay, I can.
Yes. Okay, we can have both of you answer. So yeah.
Okay. Thank you. I saw the question and I said, first of all, first things first, we need to be moving towards an Africa that is sustainable and independent and does not have to rely on foreign aid per se. That's the first thing. So if we're talking about all of these things, we should be talking about them from the point of view that we want to be sustainable. However, that is a process and it will take time and we will get there at some point. So that's the first thing. The second thing that we need to talk about is that for investment, for a country or a continent to be attractive to investments, there are certain things that must be in place. One of them is security. Second is a conflict-free area, which is the focus of silencing the guns this year. And the third is that there must be policies, monetary policies that are progressive and attractive. So now, first of all, the government in itself must invest in education. Now, if we're not talking about collaborations between governments and international companies, private companies or businesses that want to invest for returns, that means that that country must have a climate for business that is attractive. So that means that insecurity must be taken care of. In Nigeria, we've been having a lot of Nigeria been having a lot of incidents of insecurity. Cameroon, just close by, is having several challenges with insecurity. There are many countries across the continent having such challenges, and you cannot say you want to attract investment when you have not secured your people. So if you cannot secure your people, you cannot secure investors. That's the first thing. Second thing, we're talking about resolutions, conflict resolution, and peace for a place, because if you're going to build infrastructure, you're going to build masts or set up digital infrastructure, you need to be sure that they will be protected. You cannot do that in a place where anything can happen and people fight and then there's destruction and looting of property. You cannot have investment into areas that are not safe, are not protected, are not secure. So those two things are important. And then policies that are attractive. So are you looking at tax reduction in tax for companies that want to invest directly in education? Are you looking for tax breaks? Are you looking for direct support from the government for these kind of companies? Those are the things that we need to make sure are in place before we start talking about increasing foreign investment. But one thing that is important for us to note is that we cannot rely on foreign investment forever or foreign aid forever. Recently, there has been a whole scaling back by the Bill and Melinda Gates Foundation on support for Nigeria's HIV prevention infrastructure, because the Bill and Melinda Gates Foundation had been funding most of our HIV programs, providing what is hearts-free to people. But the truth is that Nigeria was never able to fully create its own proper system to cater to its own citizens. And this cannot last forever. So if you bring in foreign investors or foreign NGOs or people to work in your country, that should only be a path towards self-sufficiency and not the entirety that the country is going to rest on for forever. So that is important to note. And I think I will have Simon finish up this conversation now. Thank you.
Okay, thank you, Dr. Chiamaka. I think, yes, peace is one thing. If there is peace in an area, then people outside can actually come and invest easily. I think the other issue that we tend to actually overlook sometimes is the kind of people that we have. So, for instance, if a foreigner is going to come in tomorrow and then invest in Uganda or invest in education in Africa, are there people who are going to be working there in such an area? Are there people who are going to be like helping, working with such kind of of the investors? Are they going to be there? Will they get people to be employed in the sector? That's one. Two, yes, the policies can be very good. They can be nice looking, well designed, but are they followed? Are those regulations there to protect the investors when they come in? So if the investors are not protected, they will run away. But if there are regulations there that will actually make them be confident that, okay, in case they invest in a certain country in Africa, once they lose maybe what they invested, they can easily recover it, or they can actually go and recover it in another nation. That will give them the confidence to actually come in. The other thing that we should talk about, we should focus so much on, is the rampant corruption that we have in our countries. So you see, like in this continent, if you're a public servant, what they pay you is even less than $100 per day, per month. I mean, you can work for 30 days and you only get maybe $50. You get $100, $200. As a public servant who is having a family, how can that translate to the needs, to satisfy the needs of your family? I think that is a question that people need to actually focus on. So that gives rise to a lot of corruption, a lot of backstabbing, a lot of kickbacks. So a foreigner, for him to or how to invest in our country, they need to pay us. They need to pay us a lot of money. They need to pay us a lot of things. They need to pay our leaders, because our leaders want to see themselves benefiting, not looking at the whole generation benefiting, but they need to see themselves benefiting. So how do we make sure that Africans are paid?
Mr. Simon.
To raise people with moral standards. When we don't raise leaders with moral standards, people who are always corrupt, people who are easily, their mind easily change when they see cash, when they see dollars, when they see the euros, their minds start changing. Then there is a problem there. So we need to change that. How do we change that? By raising people with characters, people with moral characters, people who are actually able to say, you know what, this is for the benefit of my country. I'm not going to actually trade it for any coin, for any kickback, for anything. Because some of these foreign investors, they come into actually expatriate, they take the money away from our continent. So how do we make sure that leaders question that? Then the last thing, Chiamaka, is it's important for us to be on our own, to be independent. But there is no one who always stand on their own. When the foreigners come in, let's learn from them, let's transfer the technology from them and own it, domesticate it, look for ways of actually looking for making it work locally, or we even reinvent the wheel and make it work for on our own. So that when they come and they say they want to stay for 10 years, after 10 years they should go back and the invention or maybe the investment should actually remain in our countries. And then the other thing is we should be partners talking on the same table, using like the same terms. We should not be looking at people who are benefiting or beneficiaries, or people who are actually being taken care of, people who are actually benefiting from benefit or from maybe sympathy or from outside. We should be saying, this is what we need, this is what we don't need, this is what we actually want to work here, and this is where we want you to be working from. Not saying whatever you give us, we are happy for it. Whatever you give us, we are so happy for it. Thank you.
Thank you very much, Dr. Chiamaka and Mr. Touloung for that. Yeah, I actually agree that we cannot depend forever on foreign investment, because when investors give you their money, they're expecting something from you, and they have power over you by the fact that they're giving you their money. So it's up to Africa to find a way of becoming self-sufficient, but also as we're moving towards self-sufficiency, it's important for us to secure our continent and our people. It's important for us to have peace. It's important for us to have not just attractive policies, but also ensure that these policies are followed up and there's regulation to protect these investors. And most importantly, we need to have leaders who are strong in character. Thank you very much for that. So thank you very much, our panelists. We are very honored to have you today. The discussion has been very enlightening, very eye-opening, and we look forward to having more discussions along these lines in future. So we shall stay in touch. Thank you very much. I wish you a nice weekend. To our attendees, we are very grateful for making this a success. So I will just hand over to Mashkur to continue with the rest of the session. Thank you very much. Welcome, Mashkur.
Hello, everyone. Thank you very much for, just to round up, I would like to share a video about the AU Agenda 2063.
Every African has a right to proper health care, good food and nutrition, and good quality of life. African countries, in the implementation of their national priorities under Agenda 2063, have made commitments to eradicate poverty in our generation, build inclusive and sustainable economies with shared prosperity for all, through social and economic transformation by focusing on the following areas: sustainable and inclusive economic growth that reduces poverty and leads to increased income levels, equality and decent jobs, value addition in agriculture, business and industries, human capital development, skills revolution in science, technology and innovation, gender development, youth empowerment and employment generation for youth and women, social security and protection for all people and infrastructural development, good governance supported by capable institutions, manufacturing-based industrialization, promotion of culture, arts and sports, peace and security. Let us unite to build the Africa we want. Visit www.au.int to learn more about Agenda 2063.
With that, we come to around at the end of the session. Thank you very much to all our panelists. Thank you very much to all our attendees. It was nice having you.